if we're treating ADHD, one of the things we want to look at is what comorbidities are present. If depression is present, then sometimes we'll want to use Wellbutrin or bupropion, simply because this medication is kind of a 2-for-1 and that it can treat depression, and it's also used for ADHD. If there is a comorbidity of bipolar disorder, we always want a mood stabilizer on board, but stimulants are not contraindicated. So you can take a stimulant with bipolar disorder, if also on a mood stabilizer. And then if there's a comorbidity of psychosis, in that case, we're going to want to just avoid stimulants altogether. So a lot of times we'll start with an amphetamine, immediate release, or extended release, but sometimes we like to start with immediate just to see kind of how somebody is going to respond to this medication. If using a long-acting is preferred, then typically we'll try something first like Adderall XR or Vyvanse. If there's too many side effects with amphetamine salts, then we'll try something like methylphenidate, often like a Ritalin, Concerta, that type of thing. If that fails, sometimes we'll try like an extended release, or like Focalin. When we're looking at methylphenidate instead of amphetamines, typically we're going to want like a 20% increase on the dose, for equivalence. And if it's somebody with a cardiac history, then we're going to want to get like a cardiac clearance from a cardiologist. Also, if there's a stimulant use disorder history, we take that into account. If it's just ADHD alone, maybe we can use a non-stimulant like Strattera. Or again, comorbid depression, we have that Wellbutrin option. But sometimes we'll see really a lot of like prominent insomnia, nightmares, PTSD, those types of symptoms co-occurring. And in those cases, using something like guanfacine or clonidine, extended release can be super, super helpful for those symptoms. Great for anxiety, great for impulsivity, and irritability. So